Today's topic is going to be on joint pain. As you probably know, I worked in orthopedics for over 14 years and ran a foot, back, and ankle clinic in one of the clinics for several years. I had my own clinic in the mountains at a ski area for 8 years, and I saw a lot of ski injuries. Suffice to say, I'm no stranger to orthopedic injuries. I talked to a friend of mine that had shoulder pain for 20 plus years. He's not done anything about it because it was not convenient at the time. It's very, very common. I will discuss some very general things here, as orthopedics are hard to diagnose without doing a hands-on physical exam as well as some other testing. So first of all, just so you know, x-rays do not show anything about muscles, ligaments, or tendons. They do show arthritis by way of looking at joint spacing as well as some other things. An MRI is needed to see the soft tissue and can show tears, narrowing pathways, etc. Remember, I'm talking general here. So that said, when someone has a pain that's been there for a while, which is different than, I did something today and now my ankle or knee or shoulder or back hurts, the first thing to do is to put some ice on it. Heat makes it feel better but can make it worse. When heating a muscle, the blood vessels expand, causing more circulation to the muscle. This feels good, but then engorgement of the blood in the muscle can cause stiffness due to increased swelling from heat. Have you ever had a sore back and got into a hot bath or a hot shower and it felt great? Then 30 minutes after getting out of it, more stiff and soreness began to set in. Ice, on the other hand, can decrease swelling, which causes stiffness and pain. It can also cause some numbness for the area when you put ice on it. A lot of products out there that supposedly help with joint pain and swelling only have a strong smell and have no healing powers in general. Once again, I'm being very general here. There are some exceptions that are for another time. We want to do everything we can to decrease swelling. Besides ice, ibuprofen can be used to help with swelling and pain. Tylenol only helps with pain, but ibuprofen is an NSAID, which means a non-steroidal anti-inflammatory drug. Don't take aspirin and ibuprofen at the same time, as they are both NSAID drugs, and besides thinning your blood to where if you bleed it will be more difficult to stop it. You may also experience some stomach upset. After ice for 1 to 2 days, then you can introduce some heat. 20 minutes of heat followed by 20 minutes of ice. You can do this several times a day. Okay, so we injured ourselves and it hurts to move the place that you hurt. So is your shoulder or knee, foot or back, and now 1 day later you're out shoveling the garden, crawled under the truck to repair it. I've seen it 1,000 times. One of my favorites is when someone had a knee replacement or shoulder rotator cuff repair, and they come in to have their 10-day checkup, and they brag that, "Hey doc, I'm already back outside playing golf." Well, John Wayne had a saying for this that I will leave there. Just because you're feeling better does not mean that your surgical repair is healed. It takes time and lots of physical therapy. Speaking of PT, let's just stay right here. After surgery, that is when the work and the healing starts. If you don't do PT, you will not do well. Write that down. So many guys say, "I can do that at home on my own." No, you can't. You will not get the results that a good physical therapist will give you. They are very highly trained and skilled at knowing how to get you better in the appropriate time frame. Many guys got a frozen shoulder, or the medical term adhesive capsulitis, because they did their own shoulder PT, only to not get the range of motion that they needed for activities of daily living. Put bluntly, the activities of daily living is being able to comb your hair or wipe yourself with your arm. So after going back to your surgeon, and you can't move your shoulder because it's sat still and adhesions have built up, they take you back to surgery and they break all the adhesions. Then you start all over with your rehab. Best to do what your provider says to begin with. You don't know your body better than a trained provider or physical therapist, regardless of what you think. So when you hurt yourself and there's no change after a few days, then there needs to be a visit to the doctor. He can do things such as a steroid injection, maybe some oral steroids. He can provide some physical therapy. If no improvement, then he will order an MRI to see a more detailed look at the matter. There are a lot of good surgeons out there, and talking to some friends or family can get you some good names of referrals. One last thing I would say is don't base a decision to have or not to have surgery on what Uncle Bill or friend Marge tells you that their surgery did or did not go well. Or don't go to your doctor and say, my cousin had a knee surgery and he was well a lot quicker than this. I don't think you did a good job. First of all, you don't know the condition they had, the extent of their problem compared to yours. Some of you might have had underlying medical issues such as diabetes, to name one, that can hinder your healing. The length of time they let their problems go versus yours could be a factor. Do you think that my friend that had shoulder pain for over 20 years is going to come out of surgery and heal as fast as someone that had the issue for only a few months? Most likely no. Listen to your doctor and do what he says. Don't think you know better. If he says don't use the arm for 6 weeks, then that does not mean after 2 weeks I can start doing a few things. You don't want to go through the pain and downtime and inconvenience of surgery and PT just to turn around in 6 months and do it all again, because your outcome was bad because you knew better. As we age, we all begin to get aches and pains, and some can turn into chronic pain. This pain can stay with you for long periods of time. One thing that I have found is a product called Factor 4 by LiveGood. This product has 4 ingredients: turmeric, fish oil, garlic, and Coenzyme Q10. All of these have been shown in studies to be great for inflammation. I take this product daily for not only my aches and pains, but also the other benefits that these supplement ingredients provide, such as healthy heart support, joint and organ health, immune health, and healthy circulation. By all means, check with your provider with your injury and pain issues. And also take a look at Factor 4 for what it can do for you. It can be refreshing to not wake up hurting every day.